Year-old female patient presents with an insufficient composite filling in tooth 3-6. First, place an OptraGate cheek and lip retractor in the patient's mouth to enlarge the treatment field. To do so, grasp the thicker intraoral ring by reaching through the thinner outer ring. Press the intraoral ring slightly together until two wings form. Then insert one of the wings into one corner of the mouth. To facilitate the placement of the second wing into the other corner, you may use your finger or a mirror. Position the ring first in the lower and then in the upper vestibule. The ring glides more easily into the gingia buccal fold if the patient's mouth is only slightly opened and the lips and soft tissues are relaxed. Whilst the tooth is still moist, select the shade of the composite using a shade guide. Examine the occlusion with the help of articulating foil. Take the occlusal relations into account when extending the cavity. Avoid positioning the margins of the filling in the area of occlusal contacts. Ensure that the treatment field is sufficiently dry. This is best achieved with a rubber dam. We recommend that you use a rubber dam that features an anatomical shape, such as the OptraDam. Punch holes in the place where you want to expose the teeth. Seize the upper and lower rim of the intraoral ring by reaching through the outer ring and press together slightly. Insert the intraoral ring into the buccal corridor on one side, so that the elastic component embraces the corner of the mouth and the outer ring is located extraorally. Finally, place the intraoral ring behind the lower and upper lips. OptraDam now sits in a stable position. Place a clamp in the distal area of the molar. Use dental floss to expose the proximal contact points. Next, remove the inadequate filling. Prepare the cavity according to the principles of the adhesive technique. In other words, preserve as much tooth structure as possible. Bevel sharp enamel edges and smooth them out using a 25-micron diamond burr. The existing cavity is 4 mm deep. Adapt the cervical areas of the sectional matrix. Dispense of Adhes Universal from the Viva Pen onto the entire tooth surface to be treated, starting at the enamel. Brush the adhesive into the tooth surface for at least 20 seconds. Disperse excess adhesive with compressed air until a glossy and mobile film layer results. Light cure Adhes Universal for 10 seconds using a curing light that produces a light intensity of at least 500 milliwatts per square centimeter, such as Blue Phase style with a light intensity of 1,100 milliwatts per square centimeter. Next, apply Tetric Evo Ceram Bulk Fill in a maximum thickness of 4 mm. Contour the occlusal surface and the fissure relief of the restoration with a handheld modeling instrument, such as Optasculpt. Polymerize Tetric Evo Ceram Bulk Fill for 10 seconds using a curing light that emits a light intensity of at least 1,000 milliwatts per square centimeter, such as Blue Phase style, with a light intensity of 1,100 milliwatts per square centimeter. Next, remove OptraDam. Before you take the rubber dam out of the oral cavity, carefully cut the interdental latex septa. Then, grasp the outer ring and slightly press it together so that the intraoral ring is loosened from the gingia buccal fold. Next, remove the dam carefully from one corner of the mouth and then from the other. Check the occlusion and adjust as necessary. Remove rough irregularities on the surface of the filling using a fine-grained diamond instrument. The grit size should be between 15 and 25 microns. We recommend that you use a one-step polishing system, such as OptraPol, at a medium contact pressure of 2 Newton to polish the restoration. The polishing procedure is performed under water cooling. In the process, polishing residue is also evacuated. At the end, apply a thin layer of Floor Protector S. Use Viva brush or a dental brush for that purpose.